Imagine this. Your dog, maybe having a great time exploring the yard, or you're out on a trail. 1 minute, totally fine. The next, a sudden yelp. And then, wow, this rapid, scary swelling starts, maybe they seem weak or even, collapse. It's a horrible thought for any pet owner, right?
Yeah.
Especially if you live in or even visit places where venomous snakes are around. And that scenario, well, that's exactly why we're doing this deep dive today. Our mission. We've got this
Hmm.
stack of sources, veterinary guides, research notes you've shared, and we're going to unpack what pit viper bites actually are, how they affect our pets, and really critically, what needs to happen right now if it occurs. Think of it like getting prepared, understanding the emergency, and knowing what your vet's likely going to do.
And it sounds daunting, I know, but it's such vital information. Pit viper bites, they're definitely a serious veterinary emergency across a lot of North America.
Mm.
But the good news is, and this is important, with fast, appropriate care, the outcome is, well, it's often positive.
Okay, let's get into it then. Maybe start with the snakes themselves. Who are these pit vipers? How do you spot one?
Right. So the sources point out a few key things that set pit vipers apart. They typically have this really distinct triangle-shaped head. It's wider than their neck, quite noticeably. And if you look closely, not that you'd want to get too close, they have these heat-sensing pits, one on each side, between the nostril and the eye.
Ah, right, for finding warm prey.
Exactly. Helps them locate warm-blooded animals. Then there are the fangs.
Longhorns.
Yeah, long retractable fangs they use to inject the venom. And another thing, if you could somehow see the underside of their tail, like behind the vent.
Which you probably can.
Right, exactly. But pit vipers have a single row of scales there, whereas most non-venomous snakes have a double row. Oh, and their pupils often vertical slits, like a cat's eye, though that can change a bit depending on a light.
Okay, so triangle head, pit, fangs, single row of scales under the tail, vertical pupils.
Got it.
Now, who are the main ones we should be aware of, say, here in North America?
Well, the most common ones are definitely rattlesnakes. That includes the smaller guys, too, like pygmy rattlesnakes and Massasaugas. They're in the Crotellus and Cistrus groups. And then you've got the Acastrodon group. That's your copperheads and cottonmouths. Cottonmouths are also called water moccasins.
And where do they live? Pretty much everywhere.
Almost. You find them throughout most of the continental U.S.,
Yeah.
thankfully, not in Alaska, Hawaii, or Maine, but pretty much everywhere else.
Okay, here's something I found really interesting in the sources. This kind of unofficial severity ranking between them. Is that right? Like rattlesnakes are generally the worst.
That's right, yeah. Generally speaking, rattlesnake bites are considered the most severe. Then usually cottonmouths, and then copperheads are typically the least severe of the three.
Okay, and why is that? Does it relate to the effects?
It lines up pretty well, yeah. Rattlesnakes often have, well, the most potent venom overall. They can cause really severe local damage and major systemic problems. Cottonmouths, they're known for causing particularly nasty local tissue destruction and significant issues with blood clotting. Copperheads, their venom is generally less potent. Now, they still cause significant pain and local swelling, make no mistake, but their bites are actually rarely fatal to pets, especially with treatment. That's a key point about copperheads. Scary, yes, but usually manageable.
So let's talk about that venom. What is actually in it that causes all this damage? It's not just one chemical, is it?
Definitely not. It's complex stuff.
Yeah.
The sources describe it mainly as hemotoxic, meaning it affects the blood, and proteolytic.
Proteolytic, meaning
Like-
protein breakdown.
Exactly. It breaks down proteins. Think of it like a cocktail of digestive enzymes, things like hyaluronidase and phosphomanabazio. These enzymes basically start, well, digesting the tissue right around the bite site. That's what causes so much of that immediate pain and swelling.
Ouch. But there's more to it.
Yes, much more. The venom also has components that directly interfere with blood clotting. It just messes up the whole coagulation cascade, the body's system for stopping bleeding. This can lead to, spontaneous bleeding or make it really hard to stop bleeding from the bite or anywhere else. And some snakes, like certain types of Mojave rattlesnakes, even have neurotoxic bits in their venom. That can cause paralysis or breathing problems. But usually, the tissue damage and the clotting issues are the most common problems across the board for pit vipers.
Wow, it really sounds like a potent mix designed to, well, cause chaos. But the sources mention something called dry bites. What's that about?
Yes. Dry bites. It's estimated maybe 20 to 30% of bites from pit vipers don't actually result in much venom being injected,
Really? The snake bites but doesn't inject venom.
or injects very, very little. So you might see the fang marks, maybe some minor local reaction just from the puncture itself, but you won't see that severe progressive swelling or the systemic signs because, well, the venom isn't there in sufficient quantity to do the damage.
That's kind of a relief. But I'm guessing you can't tell right away if it's a dry bite.
Absolutely not, and that's crucial. You have to assume every single bite is a full envenomation until proven otherwise.
Hmm.
You need veterinary assessment, watch the clinical signs develop, or hopefully not develop. You just can't tell by looking initially.
Okay, let's make this really practical. Imagine your dog, let's call him the Max again, he's out playing, sniffing around, and gets bitten. What are you actually going to see? The sources say bites are often on the head or front legs, right, because they're curious.
Exactly. Max sticks his nose where it shouldn't be. So the first thing you'll likely notice is sudden, pretty severe pain. Max might yelp, jump back, cry out, seem really distressed. And then, very quickly, usually, you'll see rapid, progressive swelling around the bite site. It just starts spreading outwards, and it can become really extensive and tight.
Okay, pain, rapid swelling. What else?
You might start seeing bruising pretty quickly. Vets call it ecchymosis. And maybe little pinpoint red spots under the skin. There's petechiation. So purple patches and tiny red dots around the swollen area. Finding the actual puncture wounds, the fang marks, can sometimes be tricky because of all the swelling or just Max's fur getting in the way. But typically, there are one or two small holes.
And that tissue damage you mentioned earlier from the enzymes, does that show up right away?
Not always the worst of it. That digestion process keeps going. So hours or even days later, you can see what's called delayed necrosis. That's where the tissue actually dies and might start to slough off, creating an open wound. It's why wound care can be needed for quite a while. But like you said, it's definitely not just a local problem. The venom gets absorbed into the bloodstream and starts causing systemic issues.
Right, and what does that look like? What are the signs the whole body is affected?
This is where things get really serious, potentially life-threatening. Max might become weak, very depressed, just lethargic, doesn't want to move. His heart rate might shoot up tachycardia, and his breathing could become shallow and rapid. The venom damages blood vessels, making them leaky. Fluid pours out into the tissues, causing all that swelling, but also out of the effective circulation. This leads to a drop in blood pressure, hypotension, and potentially shock.
Shock. Okay. Is that fluid loss the main cause?
It's a huge factor. In dogs, the fluid often pools in the vessels in their abdomen, the splanchnic circulation. In cats, interestingly, it can affect the lungs more, causing pulmonary issues, making breathing difficult. And because the venom messes with clotting, you might see abnormal bleeding. Maybe the bite site just keeps oozing blood, or you might even see bleeding from other places, like around an IV catheter if one's been placed.
Wow. Any other systemic signs?
Yeah, the lymph nodes near the bite will almost certainly get enlarged and painful. They're trying to deal with the venom. You might also see nausea, maybe excessive drooling, tyolism, vomiting, diarrhea, and sometimes a fever develops later on.
You mentioned before that the bite location is really critical. Why is getting bitten on the nose, say, worse than on a paw?
Well, bites to the tongue, or the main body, the torso, are really concerning because the venom can get into the central circulation much faster, reaching vital organs more quickly. And bites on the head or neck, like the nose or throat area, are particularly dangerous because that massive swelling we talked about can actually compress the airway, making it hard or even impossible for the pet to breathe. That's a huge emergency.
It bites on the legs.
While maybe not as immediately life-threatening from a systemic view sometimes, bites on the limbs, especially lower down, can cause such extensive local tissue damage that it affects the limb's function long-term. Scarring, muscle damage, contracture, it can be really debilitating.
And another key thing, the signs aren't always instantaneous. The sources mention they can sometimes be delayed, maybe for up to 8 hours after the bite. So even if Max seems okay at first, if you suspect a bite, you absolutely need to watch him very closely and get veterinary advice right away. Don't wait and see.
Okay, so let's go back to Max and that hypothetical Great Dane, both bitten by the same snake.
Why?
Why might Max, being smaller, have a much worse reaction? It seems like it's not just about the snake or just about the dog, but a mix of things. You're spot on. It's definitely a combination of factors. First, there are snake-related things. Like how much venom did it actually inject? A snake that just bit something else might inject less venom the second time. The snake's size matters, its fang length, how aggressive it was feeling, its motivation, was it defending itself or actively hunting? All that can influence the dose. There's even some discussion, though it's not totally proven, that venom potency might vary seasonally, or that very young snakes might have particularly concentrated venom.
Interesting. And then what about Max, the victim?
Max's own factors are really significant. His size is a huge one. A smaller animal like Max gets a much higher dose of venom per pound of body weight compared to a big dog. So the same amount of venom hits him harder.
Right, concentration effect.
Exactly. And the bite site, like we discussed, is critical. A bite on his tongue or chest is way more dangerous than one on his paw. Then there's the time factor, how long between the bite and getting treatment. That's absolutely crucial. The sooner, the better. Always. And this is something owners can influence. Max's activity level after the bite. If he runs around in a panic, his heart rate goes up, blood flow increases, and the venom gets absorbed and spread through his body much faster. Keeping him calm and still is really vital first aid.
Okay, so you suspect Max got bitten. You do the right thing, keep him calm, rush him to the vet. How do they actually confirm it's a snake bite and figure out how bad things are? It's not always obvious, is it?
No, it's often about putting the pieces together. The vet's going to start by getting a really detailed history from you. When did it happen? Where? Did you see the snake? If so, what did it look like? How quickly did the signs start appearing? Then, a really thorough physical exam. They're looking for those fang marks, assessing how bad the swelling is, how fast it's progressing, the level of pain, and critically, checking Max's vital signs, heart rate, breathing, temperature, making sure his airway is clear, checking his circulation, blood pressure.
And blood tests, you mentioned they're important. What specifically do they show?
Blood tests are absolutely essential, yeah, especially for figuring out the systemic effects and those clotting problems. Initially, you might actually see a high red blood cell count hemoconcentration because fluid's leaking out of the blood vessels. But then pretty quickly, sometimes within hours, the venom starts damaging the red blood cells themselves. The lab might report seeing funny-shaped cells, like schistocytes or echinocytes. That's a clue.
Okay, what else?
Max will almost certainly have a low platelet count thrombocytopenia. Platelets are tiny cells involved in clotting, and they get used up rapidly when the venom screws up the clotting system. His white blood cell count will likely be high, just from stress and inflammation. They'll also check kidney function, liver enzymes, muscle enzymes like CK-creatine kinase, which goes up if there's muscle damage from the venom or just from the trauma. And albumin, a blood protein, might be low.
And the clotting tests you mentioned, those sound key.
Definitely key. The venom causes this condition called venom-induced consumptive coagulopathy, VSCC for short. That sounds complicated, but basically the venom activates the clotting system in an uncontrolled way, using up all the clotting factors. So tests that measure clotting time like PT, APTT, ACT levels will usually be prolonged, meaning the blood takes longer than normal to clot. A really important one is fibrinogen. It's a crucial clotting protein, and levels will likely be very low. And they might measure things called D-dimers, which show that clots are being formed and broken down abnormally. This whole picture confirms the VICC.
What about things like x-rays? Would they do those?
There's not usually to diagnose the bite itself, but if Max is having trouble breathing, they might take chest x-rays to look for fluid in the lungs, especially in cats. Or maybe ultrasound later to assess tissue damage. But the size the local reaction you see, either visually or on imaging, isn't actually a reliable way to judge how severe the systemic poisoning is. You can have huge swelling with less systemic effect, or vice versa.
Makes sense. So besides snake bite, what else might cause similar signs that the vet needs to consider?
Good question. They have to think about other things that cause sudden, severe, painful swelling. Could it be another type of bite or sting, like a nasty spider or scorpion? Or maybe a severe allergic reaction causing what's called angioedema. Or maybe it wasn't a bite at all, but some kind of blunt trauma or a deep puncture wound from something else. Even a bite from another animal, or sometimes a foreign body stuck in the tissue, or an abscess that suddenly starts draining can look confusing initially.
So it's the whole picture history, exam, and those specific blood changes, especially the clotting test that points towards pit viper bite.
Exactly. That combination is usually pretty definitive.
Okay, the vet's figured it out. Max definitely has pit viper envenomation. He's got that swelling, maybe he's showing some shock or clotting issues. What's the critical treatment? You said timing is everything.
Absolutely. Early treatment is paramount. It dramatically improves the chances of a good outcome. Now, for you, the owner, the immediate first aid is actually pretty simple, but so important. Minimize Max's activity. Keep him as calm and still as you possibly can. This helps slow down the venom spread. If you happen to have pain relief prescribed by a vet specifically for emergencies, you could give that, but never give human pain meds without specific vet instructions. And then transport him immediately to the nearest emergency vet clinic. Call ahead if you can, let them know you're coming.
And let's bust those myths again. What should you absolutely not do? Things you see in old movies.
Right. The sources are really clear here. Do not apply a tourniquet. It cuts off blood flow, can make tissue damage much worse, and doesn't really stop venom spread effectively.
No cutting, no sucking.
Definitely NO incision or suction at the bite site. It doesn't work, it's likely to introduce infection, and just wastes precious time. And no ice packs for prolonged periods either. Brief cool compresses might feel okay, but freezing the tissue just adds more injury. Forget the myths. Just get to the vet fast.
Okay, so Max is at the vet clinic. What is the absolute cornerstone of treatment for the envenomation itself?
Without a doubt, it's antivenom, sometimes called antivenin. This is the only specific treatment that actually neutralizes the venom circulating in the bloodstream.
How does it work?
It contains antibodies. These are usually harvested from animals like horses or sheep that have been safely exposed to small amounts of venom over time, so they produce antibodies against it. When this antivenom is given to Max, those antibodies find the venom molecules in his blood, bind to them, and basically neutralize them, stopping them from causing further damage.
When is it given, like always?
It's strongly recommended for any moderate to severe bite, especially if the swelling is progressing rapidly, if there are any systemic signs like shock, pain, those clotting problems we talked about, or if the bite is located on the head, neck, or body. There are different types, too. Some older types use the whole antibody molecule from the horse or sheep. Newer types often use just purified fragments of the antibody, like Fab or Fab2 fragments.
Why the fragments?
They tend to have a lower risk of causing allergic reactions in the patient, which is a potential complication whenever you give proteins from another species. And actually, here's a neat little tip from the sources for the vets.
Yeah.
They recommend flushing the antivenom vial with sterile fluid after drawing up the dose. Apparently, you can recover a significant extra amount of the antivenom that way, which is great because this stuff is precious and expensive.
Good tip.
Mm.
So how do they actually give it to Max?
It's usually diluted in IV fluids first. Then it's given slowly intravenously into the vein, typically over about 30 to 60 minutes. The vet team has to monitor Max extremely closely during the infusion.
Why so closely? For reactions.
Exactly. They're watching for any signs of an acute allergic reaction or hypersensitivity. Things like sudden vomiting, developing hives, difficulty breathing, or even collapsing.
And if that happens?
They stop the infusion immediately. They'll give medications like antihistamines, maybe epinephrine if it's severe, possibly corticosteroids in the specific situation. Once Max is stable, they might try restarting the antivenom again, but much, much slower, and watch even more carefully. It's also worth knowing there can be a delayed type of reaction called serum sickness that can show up maybe 1 to 3 weeks later. Less common, but possible.
Okay, so antivenom is number one. What else is critical supportive care while Max is in the hospital?
Well, IV fluids are absolutely essential. Remember all that fluid leaking out of his blood vessels? Fluids are needed to support his blood pressure, combat shock, and just keep him hydrated. And pain management is vital. These bites are incredibly painful. So strong pain relief, usually opioids, are a mainstay of treatment.
What about NSAIDs, like common dog pain meds?
Generally, no. NSAIDs like carprofen or meloxicam are usually contraindicated, meaning they shouldn't be used. They can interfere with platelet function, potentially making the clotting problems worse, and they can also increase the risk of kidney damage, which is already a concern with snake bites. So opioids are preferred for pain. And if Max's clotting is really bad or he's actively bleeding, then the vet might need to give blood products, things like fresh frozen plasma or FFP, which contains lots of clotting factors to replace the ones used up by the venom. If he's become really anemic from blood loss, he might need packed red blood cells, PRBCs. And if his fibrinogen level is critically low, a product called cryoprecipitate, which is rich in fibrinogen, might be used.
Okay, that makes sense. What about antibiotics? Seems like a nasty bite. Wouldn't infection be a risk?
You'd think so, but surprisingly, infection isn't actually that common with pit viper bites, unless there's really extensive tissue death, that necrosis we talked about.
Yeah.
So antibiotics are not routinely recommended just because there's a bite. They're usually reserved for cases where there are clear signs of secondary infection, like, fever, pus, spreading redness and heat, or if there's significant tissue sloughing.
Interesting. Now, this brings up another important question. Are there common treatments people might think would help, or maybe other vets might use, that are actually not recommended or could even be harmful?
Yes, definitely.
Yeah.
Corticosteroids, steroids like prednisone, are generally not recommended for routine use in snakebite patients.
Why not? They reduce inflammation, right?
They do, but they don't neutralize the venom itself. And they can suppress the immune system, which might actually increase the risk of infection if tissue damage is bad. They can also delay wound healing and potentially mask important clinical signs the vet is using to monitor progress. Now, they might be used short-term to treat a severe allergic reaction to the antivenom, like we mentioned, but not as a primary treatment for the bite itself.
Okay, no routine steroids. Anything else?
Heparin, an anticoagulant, should generally not be used for the VICC, the clotting problem. It doesn't help and could make bleeding worse. And DMSO, dimethyl sulfoxide, sometimes used topically for swelling and other conditions, is actually contraindicated here. It can potentially enhance venom absorption and spread it further. So avoid DMSO.
What about that rattlesnake vaccine for dogs? We hear about that sometimes. Is that like a magic shield?
Ah, the vaccine. Yes, it exists, and it's used for dogs in areas where rattlesnakes are common. But here's the fascinating thing. It's definitely not a magic shield. Its actual effectiveness is still, well, debated.
Mm.
A lot of the evidence is anecdotal, not from large, controlled studies.
So it doesn't prevent bites.
No, it doesn't prevent envenomation if the dog gets bitten.
Mm.
The idea behind it is that it might help reduce the severity of the signs, maybe lessen the tissue damage, and potentially buy the owner a little more time to get to the vet.
So it's an aid, not a replacement for treatment.
Exactly. It's considered an aid, potentially helpful, but absolutely not a substitute for prompt emergency veterinary care, including antivenom if needed. A vaccinated dog that gets bitten still needs to be treated as an emergency, just like an unvaccinated dog.
All right, so Max got through the initial crisis. He received antivenom, IV fluids, pain meds. What's the general outlook? What's the prognosis usually like after all that?
The prognosis is generally good to excellent, provided that prompt and aggressive veterinary care was given, especially if antivenom was started early in the course. With that kind of timely, intensive treatment, actual fatalities are thankfully rare.
That's reassuring. What factors tend to influence whether Max has a really good outcome versus maybe a more complicated one?
It really comes back to those factors we discussed earlier that affect severity. Things like the snake species, rattlesnake bites, still tend to be more serious overall. How much venom was injected is obviously huge. The location of the bite matters. Those head, neck, torso bites carry higher risk. And absolutely critical is the time factor. How quickly did treatment begin? Earlier is always better for prognosis.
And the pet's condition.
Right. How severe were Max's signs when he first arrived at the clinic? Was he already in shock? Did he have really severe clotting problems? His overall health beforehand and his size smaller animals are inherently at higher risk all play a role in the final outcome. Recovery definitely takes some time. Max will likely need to stay in the hospital for, say, 24 to 72 hours, maybe longer if it was a really severe case. The vet team will keep monitoring him closely, watching the swelling, managing pain, and rechecking those blood clotting tests frequently. Often they'll repeat labs maybe 6 hours after giving antivenom to see if it's worked and if more is needed. Even after he goes home, some clinical signs like swelling or soreness can linger for a week, week and a half sometimes.
Are there potential long-term problems Max might face after recovery?
The most common long-term issue is probably local tissue necrosis, that tissue death we talked about. If it's extensive, it can lead to significant wounds that need careful cleaning and bandaging at home, sometimes for weeks or even months until they heal. Secondary infection of those damaged tissues is possible, though maybe less common than you'd think if wound care is good. If the bite was on a limb, significant scarring or muscle contracture could potentially affect how well he can use the limb long term. Less commonly, you might see persistent clotting abnormalities or chronic pain issues, and very rarely there have been reports of chronic kidney damage developing later on. So follow-up is important.
Okay, let's wrap this up by bringing it back to you, the pet owner listening. What's the bottom line? What's your role if you ever suspect your pet's been bitten by a pit viper?
The absolute bottom line is, recognize it as a true emergency. Do not wait. Get your pet to a veterinary hospital as fast as you possibly can. And when you get there, be ready to give the vet team a clear history. When did it happen? Where on the body? Did you see the snake? What kind, if you know?
Yeah.
All that info helps them act quickly.
And remember what not to do, right? No tourniquets, no cutting, no ice. Just keep them calm and get them there.
Exactly. Stick to that simple first aid. Minimize activity, keep them calm, transport immediately. And, it's worth mentioning, be prepared for the potential cost. Intensive care, diagnostics, and especially antivenom can be very expensive, but they are often truly life-saving interventions.
What about preventing it from happening in the first place? Any realistic tips?
Yeah, prevention is obviously best. If you live in or visit areas where these snakes live, some simple precautions can make a big difference. Keep your pets on a leash when you're hiking or walking in brushy areas or near rock piles where snakes might hide. Manage your own yard, too. Keep the grass cut short. Clear away brush piles, wood piles, debris, basically. Remove potential hiding spots near your house. Snake avoidance training for dogs is also an option in some areas, teaching them to recognize and stay away from snakes.
And the vaccine, again, just to be clear.
Just to reiterate, talk to your vet if you're in a high-risk area. Understand it's considered an aid.
Mm-hmm.
It might reduce severity, might buy a little time, but it is absolutely not a guarantee and definitely not a replacement for immediate emergency vet care and antivenom if your pet is bitten. Don't get complacent just because your dog is vaccinated.
Okay. Wow, that was definitely a deep dive into a pretty scary but really important topic. The sources seem clear. Pit viper bites in pets are serious. They cause a lot of damage, both locally and systemically. But, and this is the crucial part, with quick action from you, the owner, and prompt, aggressive, expert veterinary care, especially using antivenom, the outcome is actually very often positive.
Absolutely. Understanding the signs to watch for and knowing just how critical it is to get immediate professional help, that's really the most powerful tool you have as a pet owner in this situation. It truly makes all the difference.
So here's something to think about. Knowing what you know now about the signs, the urgency, the treatments that work, and the ones that really don't, what steps could you maybe take today to be just a little more prepared if you live in or visit an area with pit vipers? Mull that over. And thanks for diving deep with us.